So basically with G-cell, we have two options. We can obtain cells from the hair follicle and we can obtain cells from the adipose tissue. Now both processes are very non-invasive. We would need only 3 punch biopsies of skin or 10 milliliters of adipose tissue that could be obtained using local anesthetics in a matter of a couple of minutes. So in these two choices, you have a very practical way of obtaining certain amount of stem cells from the hair follicle or from the adipose tissue with the minimum invasiveness possible. Our standard processing of adipose tissue would take us between 1.5 to 3 hours to do the whole process. In the case of G-cell, it guarantees that a patient will go in and out of the clinic within an hour because this machine would process everything in a very short period of time.